The broadcast is now starting. All attendees are in listen-only mode.
Welcome everyone to CMSA's all-member call. This is our second call for 2013. I want to welcome all of you. My name is Sherry Latimer. I am the Executive Director for the Case Management Society of America, and thank you so much for joining us. Today, as we begin our call, please be aware we will be recording our call, and that recording will be available to all of our members shortly after the broadcast. During the call, all of our attendees are muted, but you can ask questions. You just need to go down to that question box on the control panel that you see on the right-hand side and type in your question. At the end of the webinar, we will answer those questions in the order that they've been received. It is really our pleasure to be able to share with you the issues, initiatives, and processes that are currently going on with CMSA. And then as our president finishes that presentation, we'll talk a little bit about a couple of the public policy issues that we are looking at. So right now, it is my pleasure to turn over the webinar to CMSA's National President, Nancy Skinner.
Thank you so much, Sherry. Welcome, everyone, to this February all-member call. The slide you're seeing is our board of directors, and all of them want to welcome you to this call and thank you for being part of CMSA, for being part of the case management care coordination profession and advancing quality and appropriateness of care for your patients. One of the things that's happening right now is that we are looking to replace ourselves. And I say that with some love for a past president. Our past president, Mary Gambosh, who was just an amazing lady, said the most important job of leadership is to replace ourselves. So I would like to talk to you now about the election that's coming forward. Last night, let's talk first about our mission and vision. Michelle is helping me move the slides, but because for some reason my computer doesn't like the slide deck and isn't letting me do that. So I apologize that there was somewhat of a delay. But, you know, those of us who are wise and seasoned sometimes are challenged by technology. So let's talk about our mission and vision of CMSA. It says that we are the recognized experts and vital participants in the care coordination team who empower people to understand and access quality and efficient healthcare services. One of the things that have come forward with the Affordable Care Act is a national quality strategy, a quality strategy that looks at better care for individuals, better care for populations, and cost-effective care. This is what we've been doing for the past 25 years in case management. This is what has brought us to the forefront in healthcare delivery in 2013 and beyond. Case management has never been more important. And to support our strategic vision, we have a strategic mission that looks at fostering case management growth and development, impacting that healthcare policy that talks consistently about care coordination, not just as the patient transitions from one environment to another, but as the patient receives care through the healthcare continuum as they go to the physician, as they go to the specialist, even as they go to the pharmacy to get medications to assist them in their health management. And you notice I didn't say disease management, managing their health. So we have never been more important than we are today. Next slide, please. These are the strategic objectives of CMSA. Advancing knowledge. It says CMSA will be the definitive trusted source for ideas, tools, and resources for the case management practice. And I think we are, and I think that you'll be hearing some exciting things in the future. I will share with you that our board of directors will be meeting in April to talk about a more targeted strategic plan for CMSA that's going to look at moving the case manager, the care coordinator, into the next decade. And I know 2020 sounds so far away, but in a brief 7 years, we'll be moving to 2020. And those of us who are baby boomers will be moving into those years of our life where our health may be compromised by chronic disease. And incorporating the knowledge of the healthcare professional and the knowledge of the healthcare consumer together to advance that quality healthcare delivery is one of the goals that we consistently work on. Learning is our second goal, that will providing exceptional learning experiences that will enable the case management community to consistently produce superior results. And although I don't have a slide that addresses this directly, I want to let you know about something exciting. CMAG 2012 is finally, and I say that only because there has been a commitment from a number of amazing folks, led by Susan Rogers and Sherry Aliotta and Connie Commander and Mary Beth Newman and so many folks from CMSA in putting together a new set of case management adherence guidelines, the basic information that is needed to help the patient be even more adherent and persistent with their treatment plan. That will probably be available by the end of the month at the CMSA website. There will be a $10 fee for members, a somewhat higher fee for non-members. I believe it's $20 for non-members to download this information. I am extremely excited. And please stay tuned. You will be hearing more. Our next goal is community. Working with case management professionals, healthcare professionals, and industry partners to bring forward information and assist those folks to understand the value of case management. And finally, advocacy. You know, this is the foundation of who we are and what we are. And so providing advocacy, not only for our patients, but advocating for the case management professional. I've said this before. Case management is the biggest secret in the healthcare industry. Few folks know exactly what we do. And sometimes when I say I'm a case manager, people look at me crosswise, thinking my sole function is the conservation of healthcare dollars and not advancing what the patient needs to be successful at the next level of care, to be successful in managing their disease state, to be successful in asking the right questions of their physicians. So we are advocating for a greater understanding of what case managers, care coordinators do, and the value that is seen in the services that we deliver. So stay tuned. You'll be hearing more about that. Next slide. Here's the slide I wanted to get to. As I said, Mary Gambosh, who was an amazing leader, said to me 20 years ago, the most important role of leadership is to replace yourself. Well, the time has come for me to replace myself. And so each of you should have gotten an email last night. Depending on what time zone you were in, it either came at 12:30, 11:30, 10:30, or 9:30 across the scope of time zones in the United States that gave you access to the voting process. It is sometimes a challenge in encouraging folks to vote. It only takes 5 minutes. I voted already this morning. I didn't get a sticker because I did it in my home office. You know, I'm referring to the fact that when I go vote at my local election office, they give me a little sticker that says I voted today. So when you vote, I'm sending you an imaginary sticker that says you voted today. So if you would like to view the candidate information, and we have a large number of candidates. We'll go through them in a moment. Go to www.cmsa.org/vote. To cast your vote, you can do that directly from the email. There is a link there that also allows you to view the candidates' bios and then proceed with your vote. One of the important bits of information I'd like to share with you is that there is a code in the email that you got. And if you click on the link, it brings your code along. If you decide I really want to think about this a while and weigh my choices for this election, you can go later to cmsa-vote.org, but then you will have to enter your registration code, and it is important to realize that the registration code is not your membership number. It is a unique number to you that is provided in that email. Next slide, please. Here are the candidates that are running for president-elect of CMSA. Laura Bachrach from Arizona, Kathleen Frazier from Texas, and Melanie Prince, who is with the U.S. Air Force. She has a hometown of Maryland. She belongs to the local chapter in Washington, D.C., but right now she's in Mobile, Alabama, going through some additional leadership training, I believe. These are our choices, and I'm so excited that such qualified candidates have come forward to lead us in 2014 through 2016. The next office that is available is the Office of Secretary. That includes 2 candidates, and I'm so excited that there are no positions available this year, that there isn't at least 2 choices for you to make for that office. And the 2 choices for Secretary are Karen Chambers Knight, who is from Alabama, and Mary McLaughlin Davis, who is from Cleveland, Ohio. We have 3 positions available for the Board of Directors, and those 3 positions have 8 candidates running. So good choices. Take a moment to look at the candidates and vote for the folks that you feel are going to lead us as we move into this very important era of case management. Deborah Lee, and I'm going to say her name wrong, Blighter from Arizona, Sheila Benyon from New Hampshire, Kathleen Campbell from Texas, and then we have 3 additional candidates that include Janet Coulter from Ohio, Sandy Zander from Wisconsin, Colleen Morley-Wines from Illinois, Jose Santoro from New York City, and Barbara Mackey Ziegler from Ohio. I want to thank all the candidates for taking time to submit their names. I want to thank them for having the passion to seek leadership in this organization, because it takes that passion to move CMSA forward. Next slide, please. This is your board, your vote. It has never been more important than it is today. So please take that 5 minutes to vote. Very often, less than 10% of the membership do vote. And I know I'm speaking to the choir, because you wouldn't be on this call if you weren't dedicated to the practice of case management, if you weren't an active participant in the membership of CMSA. And so I'm going to challenge you, as I often do. Call up one of your colleagues who is a member of CMSA and say, did you get the email? Will you vote? And then challenge them to call somebody else, so that we can have an even larger response to this opportunity to select our future leaders. And then I want to invite you to come to New Orleans in 2013. I would have liked to be in New Orleans last night because I understand they had a small celebration called Mardi Gras, and yesterday was Fat Tuesday. But it will be no less exciting as we move forward. And this will be your opportunity to meet the folks that you elect to the National Board as they take those seats at the conference, which will be from June 25th to June 28th. This year's theme of the conference is CMSA, lighting the path, leading the way. There has been, as I keep saying over and over, no greater recognition for case management that has come today. And we truly are lighting the path for care coordination, leading the way to bring our colleagues, to bring other healthcare professionals, to bring the patients along the way to achieving the goals that the patients want to achieve. So think about joining us in New Orleans. We will have an amazing time. We are going to have not only a get-together of case managers, but it's almost a get-together of family. I never get more hugs than I do at the CMSA conference. It is the family of case managers coming together to learn, to collaborate, to understand some of the new things in our profession so we can do an even better job of working with our patients to achieve those goals. We will have 2 hotels that are available, and I encourage you to please reach out to those hotels and make your reservations as soon as possible. They are the Hilton Riverside and the Hampton Inn & Suites that are very close to the convention center where we will be having our meeting. Next slide, please. Some of the keynotes include Dr. Carl Hammerschlag, who is an authority in the science of psychoneuroimmunology. That's a tough word to say on the early morning in Tennessee. Really talking about mind, body, spirit medicine. He works with the Indian health system and has amazing stories. I think you will be fascinated by the words that he has to say. Next slide. An additional keynote is Jill Bolte Taylor. She is an amazing lady who suffered a stroke and tells her story. She has been on Oprah. She has a wonderful TED video. I think you will be fascinated by the information she has. And finally, we have a musician and a comedian who will captivate and engage us and really inspire us as we lead this conference and go back to practices in our home communities. Inspire us not only to do a better job of caring for our patients, but do a better job of caring for ourselves. And that's something I haven't mentioned to you in previous calls. I really feel that we need to take the time to care about ourselves. Take care of ourselves. We're so busy taking care of others that sometimes we forget to take care of ourselves. So part of this conference is going to be taking care of you. How do you take care of you? How do you make sure that you find joy and passion in the practice of case management? I fly in airlines from time to time, and when the oxygen masks, they come down, or they say they come down, and I hope they never do. But while they're doing the little, here's the exit doors and put on your seatbelt, and here's how a seatbelt works, they always say if the oxygen mask comes down, please take care of yourself first. This is going to be a Take Care of Yourself First conference where we really focus on taking care of you so you can take care of others. Next slide. In our pre-con, based on some suggestions from our membership, there will be a pre-con that looks at case management in the acute care world. It's going to be an 8-hour program focused on the roles and functions of the case manager in the acute care environment. Some of the speakers will include Brady Augustine, who is a gentleman who has worked closely with CMS. He's going to talk to us about some of the new reimbursement focuses of CMS that really impact the acute care case manager. BK Kazar will also speak. BK is a consultant in acute care environments, and myself. I will also be speaking at this pre-con to talk about case management in the acute care environment. One of the other things that happens at conference is following our membership meeting, we will have an award ceremony to recognize folks who have made a difference in the practice of case management. And the first folks we're going to recognize are our chapters. These are the awards that were given last year. They were given to the award for chapter conferences, were given to the folks in Kansas City. The award for education went to the chapter in San Antonio for membership. New York City chapter for print and publishing. The award went to the folks in Las Vegas, and you can tell it's Las Vegas. They've got their dice there for technology. The award went to the Long Island chapter, and the last award for public policy and advocacy went to the New England chapter of CMSA. Next year, I want to see your pictures up here. I want to make sure that you are recognized, chapters are recognized for the amazing things they do for their members every day. Another award that's given out at annual conference are the individual awards, and that is Case Manager of the Year, given to an individual whose notable contributions and exceptional dedication have provided a positive vision for the future of case management. This prestigious award recognizes those leadership qualities, both professional and personal, which have encouraged others to develop their own gifts of leadership, and whose continuing commitment has shaped the industry. Last year, this award was given to a member of, from New York, Laura Ostrowski. Another award that is given, an individual award, is the Award of Service Excellence, given to a case manager who exemplifies the essence of case management, innovation, creativity, collaboration, and resourcefulness. This award recognized the in-the-trenches grassroots case manager whose day-to-day practice has transformed the field and contributed to the greater good, not only for their clients but for the community. Through this distinguished honor, CMSA desires to recognize the extraordinary importance one individual can make through outstanding initiative, inspiration to others, and significant contributions to improving the quality of practice. Last year, that award went to Barbara Mackey-Ziegler from Ohio. And then there are two awards that are given for research and innovation. These awards recognize an individual, group, or organization that uses findings from research or quality improvement for innovation in the practice of case management or have improved client-patient outcomes. The two awards last year went to Hudson Health Plan for Operation We Care, and the second award went to the VA of Connecticut for case management in a web-based tracking system for cancer care, improving access and quality of care. We are honored to be able to recognize the folks that I just mentioned for their absolute contributions, whether it's at the chapter level, the individual level, or at the case management research and performance improvement through delivery or a payer system. These people have been honored, and we look forward to getting your entries so that we can honor your colleagues in the future. To submit for the Chapter Excellence, Innovation Awards, and the Case Manager of the Year, and the Service of Excellence Award, the deadline is tomorrow. You can download the forms at cmsa.org/awards and send the entries to cmsa@cmsa.org. The other awards for research and improvement, the deadline for those awards is, I believe, March 4th. And we will send further information to you, or you can, again, go to cmsa.org/awards and download further information. Next slide, please. CMSA Today, your voice, your story, your publication. I want to encourage you all to submit about the innovation you're doing so it can be considered for publication in this professional journal. One of the things I do every time the journal comes out is I write an opinion, an editorial. I'm going to ask you to do me a personal favor. In the next journal that is coming forward, please take a moment to read Frank's story. It's a story I wrote from my heart about a gentleman in our community that shows what happens when case management isn't available, when patients are moved from one environment to another without getting the support they need to be successful. It validates why we are so important to the healthcare system and what happens when we're not available. So please take a moment to read Frank's story. And if you have any suggestions on how we can assist Frank when he is just lost in the turbulent waters of healthcare delivery, please feel free to email me at casemanager@icloud.com. Again, casemanager@icloud.com. And while you're emailing me, please tell me, what topics do you want to read about? What topics do you want to see? What are the things that are most important to you as we move forward? Next slide. This is the year of the case manager. As I've said over and over again, care coordination, part of healthcare reform in America. And as we at CMSA, as your leaders, as your board of directors, as our staff at CMI, hear your words, hear the folks in Washington talking about us, we know we need to bring even more value to our members and our potential members and our subscribers. So in 2013, I want to remind you that our library offers CMEs at no additional cost to membership. Now, there are some disclaimers. There are some exceptions. The extended conference still has a cost related to it. But the vast majority of the CEs on the CMSA website are available to you at no cost. And again, we're listening for your voices. What's important to you? How should information be presented? I want to give you sort of a little insight into our conference that I forgot to mention when I was talking about New Orleans. We're going to have an app for the conference that you can download to your smartphone, to your iPad, to your other device, any other device you have. that'll help you navigate the conference center. So we won't have to kill so many trees, but more importantly, you will have access to it without stuffing it into a bag that you have to lug around through the entire conference. We all know you have your phone with you. We all hide it under the table so no one knows that we're texting someone else or are reading our emails or we're dealing with a crisis with a patient. So it's with you. We're going to have an app for our conference. There is an app for that, and we are excited about that. But again, tell us what's important to you so that we can provide it. What's the most important thing in your practice of case management that CMSA can help you with? And send that out to us. Next slide. State of the Industry Survey. Every couple of years we do a survey, and we get surprisingly good response to the survey. But I ask you for even greater results. Text a friend. Reach out to them. We'll put it on our LinkedIn website. When the survey comes forward later on in the spring, it's going to provide CMSA with a snapshot of where case management is today. It's going to tell us who you are, the professions you represent, credentials you possess, the roles and functions of your position, your practice setting, where is it? What are your caseloads and associated acuity? What are the benchmarks that define being a successful case manager and what's important to you? We've been doing this for the past 10 years or so, every couple of years, and we would like to take that information and develop a white paper that provides a historical perspective of where we were, the development of case management, and maybe we can use this information from the survey to sort of help define the path that we're taking to the future. But the information will not be valid if you are not open, honest, and participatory in the survey. So I'm going to ask you again, please, once you get the survey, fill it out, send the information, and we'll work, we hope, on putting forward a white paper if that's the direction our membership gives us. Next slide. We are consistently scanning the environment. What's going on in the practice of case management? And one of the most significant things we do is the Public Policy Committee, at least as far as committees go. We have chapter liaisons to the Public Policy Committee that can bring to your chapter information on what's going on in Washington, D.C. Because the explosion in care coordination and case management that we see now is directly related to some of the actions that were taken on the Hill, some of the actions that were taken by the White House, some of the things that are going on in CMS. So being aware, and again that word participatory, in the legislative process, sending your concerns to the folks that represent you in Washington, D.C. is vital, and our Public Policy Committee helps us do that. So there are chapter liaisons to the Public Policy Committee. If you lead a chapter and you don't have a chapter liaison to the Public Policy Committee or PPC, I ask you to consider that. Also, in the past, we've done CMSA on the Hill, or the Public Policy Summit, in the spring. Because of the new elections, because I think that some folks are still finding their way in Washington, D.C. that were newly elected, and because they have some significant issues to deal with this spring, we have made a determination that we will move the Public Policy Summit, or as I like to call it, CMSA on the Hill, because we're out there talking to our representatives. We're moving that to a fall date. So it's not going away because you haven't heard about it in the spring. We've just made a decision that probably October would be a better month to meet with our representatives and really give them a picture of what case management and care coordination is. But that doesn't mean that we are going to be quiet. are not up knocking on doors in the interim. CMSA, representatives of CMSA have met with congressional leaders, White House representatives. Sherry Latimer and myself have met with Marilyn Trevenor, who was the acting administrator of CMS and has been now appointed the administrator of CMS, the director of CMS, and pending acceptance of that nomination by Congress. We will continue to do so. We will continue to go to Washington, D.C. and continue to meet with anyone who is willing to listen to us about case management. And in a moment, Sherry's going to give you some further information on some of the exciting things that CMSA is doing in partnership with other groups, including the National Transitional Care Coalition, to advance care coordination and case management through every transition of care. Next slide, please. And in fact, this brings us to Sherry's discussion and her scanning of some of the things that are going on in the case management world, the care coordination world today. Sherry?
Thank you, Nancy, and thank you for an excellent overview of the initiatives that CMSA now has and is moving forward. I wanted to share with everyone on the call that there are several things in both regulatory provisions and government relations that we should all be aware of, and encourage those of you to get involved with public comment around these. One of them is URAC, one of our accrediting bodies, has just released proposed new case management standards and case management performance measures. And this is their version 5.0. They released those this week. They will be up for your review and for your comments through March 11th. And I encourage everyone to look at those updated standards and the measures that they are recommending. This is our opportunity to give our feedback, to talk about the concerns that we may have with what we see in the standards, and recommendations on how those standards might be further enhanced. You will notice as you review those standards that you will see additions for case management around care coordination and transitions of care, the involvement and further documentation of the patient engagement and the activation and advocacy that we do. And this is a great opportunity. So on this slide is the website and the URL that you can reach those standards to review and then to provide comment. And I encourage you to do, not only as individual case managers, but those of you that may be on that represent employer of case managers or health plans or hospitals, you may want to forward that information on to others, so that our industry really gets an opportunity to provide feedback on this process. As we go to the next slide, there have been multiple questions that have come across our national desk around the 2013 Medicare fee schedule and the particular issues around the post-discharge transitional care management services. I just wanted to highlight a few points for people to be familiar with. CMS has 2 new payment codes that are out for that transitional care management, and those are for those services that are provided when patients are being transitioned, discharged from acute and the rehabilitation and long-term care hospital stays back into the community. This is the first time that care coordination transitional care services are really being recognized. Today, those codes are available to qualifying physicians, physician assistants, and advanced practice registered nurses who can actually bill for those codes. Somehow we moved to a slide. Can we go back to that other slide so that I can highlight that, please, for our folks? That transitional care management does require a face-to-face visit with initial patient contact, medication reconciliation within specified time frames. But it also allows, as we move to the next slide to look at those codes, non-face-to-face participation, because communication, as you look at the division between the two codes, one moderate complexity and one high complexity, talks about communication, either direct contact, telephonic, it can be electronic with the patient for some of us that have patient portals to communicate, and with the family caregiver within 2 business days of the discharge or transition. The issues of looking at medical decision making at that moderate level, but it does require, as you can see, a face-to-face visit after that post-discharge within 14 days. The higher complexity code that can be used is, again, for communication, but that visit within 7 days of discharge. In the actual regulation, there are examples of the non-face-to-face activities that can be included under this TCM code. And I think it is extremely important that we are familiar with those because they are many of the things that we as case managers do. They are communication, education, support around advocacy, adherence, the components of answering the resource management and being able to tie those resources together. This is a first step in really acknowledging the amount of work the collaborative team, physician and physician assistants and advanced practice nurses do. And I am very hopeful that in the future we will begin to see an expansion of those codes to other disciplines, registered nurses, case managers, social workers, for the work that they also do in transitions of care. It does allow, though, for those of us that are working in accountable care organizations, hospitals, patient-centered medical homes, for physicians to really bill under these codes for some of those services. But the only folks that can bill at this point under these codes are physicians, physician assistants, and advanced practice nurses. Now, what should we be looking at going forward? Our next slide, as you know, when we spoke with you in December, we talked about the Medicare Transitional Care Act of 2012. Earl Blumenauer introduced this bill along with, it was a bipartisan bill in 2012, and it expanded the definition of transitional care facilities and clinicians on the transitional care team. And as I shared with you in December, we are clearly identified that as a transitional care team provider, physicians, pharmacists, nurses, advanced practice nurses, social workers, case managers, and allied health. We expanded that role. We expect this bill to be reintroduced in 2013. We'll give you a heads up when we see that, and as we can support our legislators in really looking at this and expanding that, because our challenge over these next few months and into the next couple years is care coordination, transitions of care, that resource management, patient engagement and advocacy, which are the roles and functions endeared to case management, are going to be focused more and more into healthcare reform. And we need to ensure that we are looking at the provisions, the acts, bills that will help us support and get to that point of where we are able to cover the multidisciplinary team that provides these services. I did want to also highlight, I had a question last week from one of our members asking about the CPT codes that CMSA in 2008 worked to have included under the AMA's CPT code billing. Those are for telephonic care coordination management codes. They still are there. They still have an end status for us as case managers. We are working, again, identifying those, talking with CMS and other legislators about those codes and being able to really utilize those. So although we are not able to use them within the Medicare population, I am aware that some of our health plans are using some of those codes. So we're moving. We're further ahead than we were when we started this process in 2008, but we still have a significant way to go. And having your support, having your push as we move in this direction and an understanding of what that means to the case management community is absolutely key. So I hope that clarifies some of the areas that we can work together. Please do go out and look at the URAC standards. be aware of those physician codes for care coordination, and that physicians can use those 2 codes along with advanced practice nurses and physician assistants, and that we will be working both with public policy and with other partners. In looking at these, we are partnering with the National Transitions to Care Coalition, the National Association of Social Work are many partners within that, and with those that are committed to improving the care coordination and transition process for patients and the family caregivers across the healthcare continuum. Thank you, Nancy, for the opportunity to address that.
Thank you, Sherry. And before we open it up for questions, I just want to add one more thing. Please consider being part of the CMSA LinkedIn site, and not a passive part, but a participatory member of our LinkedIn community. We are trying to use that LinkedIn community to bring you information as it comes forward, so it's timely. So it's happening today, or it happened yesterday, and it's going to impact the case management field. We're going to put it on our LinkedIn site. So we will send information to our membership. If you're not part of the LinkedIn site, how to become part of the LinkedIn site. And please look at it from time to time to see what's out there. I will put some information today on the LinkedIn site about complex chronic care coordination codes that physicians can now bill for activities of their staff. So just like Sherry talked about transition of care codes, these are complex chronic care coordination codes that became available the first of the year, and that will go on our LinkedIn site today, later on today. So thank you so much for being part of this call, and I would now like to open it to any questions you may have. Thank you.
Okay, Nancy, this is Michelle, and I don't currently, oh wait, one just came in. Let me see what it is. Okay, will the TCM physician CPT codes work for transitional care utilized for patients in swing beds? Do we know?
There's not a clear provision around the utilization at the point of swing beds. It is from the acute care, as you saw in the first description on the slide, from acute long-term care and post-care into the community. So it may be possible. The follow-up would be by the physician in the community. I cannot give you any more detail than that, but we definitely can look into that.
Okay. And if anyone else has any questions, there is a question box in your control panel. If you'll type that, and I can get that information to Nancy and Sherry to be answered.
I would just like to say to the membership, to anyone on this call, if you have a question, you don't have to wait until we have an all-member call. Please feel free to reach out to us. Every board of director, every officer in this organization is listed on the CMSA website. You can reach out to us. We are happy to respond back and assist you in any way we can. And if you have a question about case management, I can promise you somebody else out there has that same question. So again, I encourage you to use social media. We're all learning about it. My grandson taught me everything I know about social media. So if you don't know, ask a young person to help you. And I'm being facetious here, but really, this is a way to connect, a way to learn from each other, and I think it is the way, one way that we can help do an even better job of providing case management services to our patients. Michelle, any other questions?
A couple have come in. One was a comment that Jill Bolte-Taylor is a phenomenal speaker, and this person has heard her in person, and she makes a rather dull subject lively and engaging, so that's good to hear. One question about, are we on Twitter as well, and do we have chats on Twitter? And we are on Twitter.
Absolutely. I am Case Manager 1 on Twitter. And CMSA. Brianne is on this call. Brianne is our social media guru who is a member of CMI staff. Brianne, do you want to make a comment? She's probably on mute, but I can tell you that she can assist you or put forward some information. Brianne?
Yes, Nancy, can you hear me now?
Yes.
Okay, very good. I just wanted to say that the official Twitter handle for CMSA is CMSA National. And for this call, we have been sending out tweets with the hashtag CMSA News. If you want to contribute anything, we'll be happy to retweet it. So we do monitor the feed daily and post daily, and so you can always ask questions through that channel as well.
Thank you, Brianne. Other questions?
The next two I can answer for you. It just wants to know if the webinar link will be available of this recording or when it will be available, and then if any CEs are available for the webinar. So for those of you that are on today, you'll get a confirmation or a follow-up email that will come out in a couple of hours following the session today, and it will have the link to the recording embedded in that. For anyone that registered who didn't attend, they will also get a link in their, we missed you email that went out. If any of you are listening by phone only and couldn't see the slides today, you will also get that in your email. And you'll be able to forward that to anyone else that you would like to listen to the recording as well. And there are not CEs on this. This is more of an informational webinar to keep you posted on what's going on with CMSA versus an educational topic. Anybody need to add? Okay. And that was all so far.
Well, if there are no further questions, thank you so very much. And know that we are here to assist you as we can as you go forward to make a difference for your patients. So thank you very much. Sherry, any final comments?
No, I just want to thank everyone for attending, and as Nancy said, any questions, please let us know. And Nancy, thank you so much for a great overview.
Happy Valentine's Day tomorrow to everyone. Goodbye.